The effects of leadership style on hospital staff's mental health. Potential implications on organizational outcomes essay by Carlisle Richards Jr., Houston Christian University, as part of a multicultural issues in mental health class taught by Dr. Amanda Ford. Abstract. Leadership styles influence staff's mental health in hospital settings essay overview. This literature review centers around connections between leadership styles and mental health within workplace settings. Hospital systems are fast-paced, intense environments where leaders are faced with emotional labor, staff shortages, and an increased demand for quality patient care. The behaviors leaders exhibit have powerful influences on work climate, employee well-being, and organizational outcomes. The objective of this literature review is to analyze existing literature regarding leadership styles and staff mental health outcomes, burnout, job satisfaction, and organizational effects in hospital settings. 5 peer-reviewed articles were reviewed to determine common themes throughout available literature. Results have shown that leadership style has important implications on employee well-being, burnout rates, and hospital outcomes. The purpose of the study is to analyze how leadership styles affect hospital staff's mental health. My research question is, what influence does leadership style have on staff mental health and organizational outcomes? Leadership behaviors have been found to influence organizational climate and staff resilience. Leadership style may be an important modifiable factor to improve hospital staff mental health outcomes. The method that was used for our search strategy was PubMed, PsycInfo, and CINAHL databases were searched using keywords related to leadership styles and healthcare worker mental health outcomes. Some of the search terms were leadership, healthcare, mental health outcomes, transformational leadership, hospital staff burnout, leadership styles, nurses' well-being, healthcare leadership, healthcare workers' job satisfaction, organizational leadership, behavioral health, staff psychological stress. Method inclusion criteria included peer-reviewed articles, study focuses on leadership styles, study focuses on healthcare workers, examines psychological outcomes such as burnout, stress, job satisfaction, and well-being, which were published within the last 10 to 15 years, written in English. Some of the exclusion criteria is non-healthcare related organizations, articles that did not have findings, articles not related to leadership, and articles focused on leadership but did not focus on staff outcomes. Results of study 1 and 2. Study 1, a positive relationship between transformational leadership and nurse burnout and job satisfaction. Supportive leadership is linked to better health outcomes for hospital staff. In study 2, leader styles were associated with staff engagement. Leadership plays an important role in workplace environment and psychological safety. Results, study 3 and 4. Leadership impacts employee mental health outcomes. Hospital leadership impacts physician burnout. Leaders who communicate with staff about concerns can improve morale. Results of study 5. Leadership can reduce burnout with the right focus on staff well-being. Hospital organization and culture affect staff burnout and mental health. The majority of articles found reported that leadership had a positive relationship with staff psychological outcomes when it was supportive and/or transformational. Conclusions. Leadership style has been shown to have a significant impact on hospital worker mental health. Transformational leadership led to increased psychological safety and support. Supportive leadership helped to decrease burnout rates and improve retention. Leadership sets the culture of an organization, which directly affects worker mental health. Leadership should be considered a structural determinant of hospital staff mental health. Implications for practice. Based on the reviewed literature, healthcare organizations should promote supportive leadership behaviors, hold leaders accountable for staff well-being metrics, ensure that leaders make their staff feel comfortable speaking up, create a culture of staff support to improve resilience, and leadership style can impact hospital staff mental health and patient care outcomes in behavioral health settings.